Hello and welcome prospective residents. I'm Terry Matsunaga. I'm a professor in medical imaging with adjunct appointment in biomedical engineering, and I'm here today to talk to you about the research activities or the research component in the Department of Medical Imaging. Here is our research division. This photograph was taken about 3 years ago, and so there has been some turnaround, but we're about the same size, I would say. I'd like to tell you about the research component of our department in medical imaging here. We are a multidisciplinary group with a lot of expertise in a lot of different areas of imaging as well as theranostics. Our research mission is an integral component of our department, essential for improving and strengthening our educational and clinical efforts, in this case for you. Our focus, however, is basic science and technology and the basic development with a translational focus. So we want to advance a lot of our technology into the clinic, as well as promote advancement and implementation, state-of-the-art infrastructure technologies that impact imaging and informatics systems through UAHN. And I might emphasize that big data is one of those components, and we're represented strongly in that area. Our research division is comprised of about 15 core faculties. Sometimes it varies. Our main appointment is in medical imaging. However, all of us have joint appointments in either engineering, mathematics, or optical sciences. Primarily, that's where we recruit our graduate students, our MS and PhD students. We have 5 core associated faculty. We have a research staff, and we have approximately 20 graduate students, MS and PhD. I have MS and undergraduates at the time, plus frequent undergraduates, and a very dedicated and associated administrative staff. Our major sources of support, you can probably guess, is the National Institute of Health. However, there are some funding from the National Science Foundation, the state of Arizona, the Department of Defense, the College of Medicine, Engineering, Optical Sciences, foundations, as well as industrial partners. In other words, small business technology transfer grants from the NIH. Now, just to tell you a little bit about some of our different parts of our division, gamma ray imaging, where this is led by Dr. Lars Furenlid, where we develop new gamma ray imaging instruments with dramatically improved spatial and temporal resolution, which means that we try to develop new detectors, electronics and systems, adaptive and multimodality imaging, image science and image quality, a very, very large component in our division, brain imaging, which crosses many other disciplines, as well as theranostics. In this case, we have clinicians who are doing clinical trials currently for targeted alpha-beta therapy in conjunction with gamma ray imaging. Our magnetic resonance imaging division is dedicated to the development of new technology for clinical and research applications. In particular, accelerated scanning. You probably all know that MRIs oftentimes take a fairly large amount of time, and we're trying to accelerate that scanning and make it condensed into a shorter period of time. Parametric imaging, signal and image processing, so we can maximize the resolution as well as the visual acuity in our images, as well as technology and applications. In ultrasound, which is my area of focus, we have new frontiers in ultrasound imaging. We currently are developing cutting-edge technologies such as photoacoustics, in other words, excite with light and listen with sound, thermoacoustics, acoustoelectrics for imaging lymphatics, guiding cancer therapy, and functional brain imaging. Brain imaging, since the start of the BRAIN initiative by the NIH, we have focused a lot of attention on brain imaging, and the development of contrast agents for early detection of cancer and cardiovascular disease. That is where yours truly is focusing his research. Our next generation in computed tomography technology, where we are developing compression-free, fully 3D dedicated breast CT for subtle cancer detection. In other words, to make the actual CT imaging much more comfortable for the patient. low-dose CT. It's always good to minimize the amount of radiation for those quality images. Multispectral imaging from single acquisitions, and patient-specific disease and disease-specific imaging techniques. One of the other aspects of our research is optical imaging, where we have developed optical biopsy devices, window chamber models, tumor microenvironment, the look to tumor microenvironment, especially in the preclinical arena, as well as multimodality imaging. So here's an example of some of our faculty members who are currently conducting research. Art Gamitro and Andy Rouse do biomedical imaging, and in particular, Dr. Gamitro has developed an optical biopsy device. He also is one of the leading experts in our area in window chamber models for looking at tumor microenvironment and multimodality imaging. Here's an example of his confocal microlaparoscope where he does real-time optical biopsies. Our MRI team is comprised of a dedicated group of researchers, Maria Altbach and J.P. Galans, as well as Ted Schruard, who are all experts in the area of MR imaging, as well as developing techniques for blood-brain barrier delivery. Maria Altbach is well noted for her work in cancer as well as cardiac imaging. And Ali Bilgin, who's an associate professor in medical imaging, is an expert in the area of big data. So as we develop more complex devices that require more data to be stored, Dr. Bilgin is working on a seamless transition into quality images. Our nuclear medicine imaging is led by Lars Furenlid and Eric Clarkson, as well as clinically Dr. Severe Baruch, who is the division chief of medical imaging, who is now leading the effort at the University of Arizona to conduct clinical trials on a theranostic agent that targets PSMA, prostate-specific membrane antigen, as well as, once it finds the tumor, treating it with alpha and beta nuclei for ablation. Matthew Kupinski, who's primarily in optical science, is also a co-investigator in many of these studies, as well as James Wolfenden, who is our clinical liaison as far as conducting clinical research here. Continuing on, our ultrasound team is led by Russ Whitty, who's a professor in medical imaging, optical sciences, biomedical engineering, as well as appointments in applied mathematics and neuroscience. On the contrast agent side for ultrasound, me, yours truly, Terry Matsunaga, professor in medical imaging, I do work with microbubbles, as well as what's referred to as phase change contrast agents, which are particles that actually convert into microbubbles once incinerated and activated. Our CT team is led by Andrew Carreras, as well as Srinivasan Vedantam, who are both very, very well known in the area of breast cancer research and breast cancer. In summary, the University of Arizona Department of Medical Imaging is a nationally recognized clinical department with cutting-edge technology in both clinical and research divisions. We also are very focused on translational research, which ties the two disciplines together. We're very well funded by federal, state, and industrial support, as well as collaborations throughout the country. And we have many resources and opportunities and support for residents. So we hope that should you choose to come to the University of Arizona, that you will consider a career as a clinician researcher and begin your training here, both in research and in the clinic. But regardless, we wish you the best of luck in all of your career endeavors and hope that you will have a wonderful career. Thank you very much.